Hi, I'm Tamara, and this is TELUS Talks with Tamara Taggart. Hi, everyone. Today I'm speaking with Dr. Daniel Kalla. Dr. Kalla is an internationally best-selling author. His latest medical thriller, Lost Immunity, draws inspiration from his day job, and his day job is as the head of the emergency department at St. Paul's Hospital in Vancouver. Thank you so much, Dr. Kalla, for being here. Can I call you Daniel?
Of course. Nice to be here with you, Tamara.
It's really good to see you and to talk about this book, Lost Immunity. I mean, this isn't, you said you've written 12 books. We were just talking about that. You've done this before. You know how this goes. This one, the timing, though, just seems impeccable, really, if you will. Why don't you explain what this book is about?
Yeah. So we can chat about the timing because it really is incredible how it worked out. But basically, it's a thriller built around the hot button issue of vaccination. The story basically in a nutshell tells of a new dreaded strain of meningitis that's sweeping through Seattle, and it's targeting older children and killing some within hours. And there's this new unproven vaccine that might be the city's only hope. And implementing this vaccine campaign falls to the hero, Dr. Lisa Dyer, is the chief public health officer. But after a few vaccine recipients dies, it becomes clear that somebody has their hands on the scale, or it's a bad vaccine. And as the meningitis epidemic soars and the trust in the vaccine plummets, it falls onto Lisa to figure out what the hell's going on, and will she uncover a Trojan horse conspiracy in time before it's too late. So it tackles all the issues of vaccine, pro-vaccine, or science, as we like to call it, versus vaccine hesitancy and stuff. And so I really wanted to tackle this big theme issue even before COVID vaccines, because it's such a vitally important topic to us. And this, for me, I write novels, so I wanted to do it in the form of a thriller. And this was the ideal theme to make what I hope is a very exciting and also educational story. And it happens to be extremely relevant based on what's going on now. Yeah.
Okay, so let's talk about so you're the head of the emergency department at St. Paul's, which, I mean, that emergency department is colorful and tense, and I've been through that emergency department a few times. How do you write to relax, or do you write to how do you separate the two? I mean, I would think that you're very busy with your regular job.
I think there's a few. First of all, I don't work full time anymore. As you said, I have an administrative job, and my writing is part of my career now. So I only work about half time, and our shifts aren't that long. I mean, some of our night shifts are only 5-6 hours long. The longest shift we have is 8 hours. So even though it's an intense time, I do get a lot of time off, and I get a lot of weekday time off and time when other people are busy, to tackle. It's been the ideal job, actually, to complement a writing career, and the two feed off each other. I find that I need a release when I have frustrations or other things I need to vent from a shift. I can go do that through writing, and writing is a very solitary pursuit. And so it's so nice to be able to, after writing for days or weeks on end, to go and meet people and talk to people and interact with people, because it's very social in the emerge department. So to me, it's a great balance right now.
Yeah, I mean, it makes sense, but I understand exactly what you're saying, and how the two could actually work hand in hand very well for someone who's working such a stressful job, yet can be creative in another way and release that stress, I guess. Your ideas for your books, how much is there any real life? Does it make its way in there? Lots?
Yeah, of course. I mean, and that's my gimmick as a writer, is to be able to take people behind the curtain, as it were, in medicine. I don't, try to base it on real people or, real patients or real staff I work with. That doesn't work out anyway. Apart from the confidentiality issues, you just make them characters. But I'm inspired by the reality of what I do, And to be honest, it was very specific that my publishers and I were talking about the next book about 2 years ago. And they said, well, what important issue in medicine would you like to tackle? And I said, vaccines they're so important. The anti-vax movement that's risen over the years has had such an impact on, infections and will continue so. And I really wanted to make a statement in this book. And so there's a ton of reality in real life here, you know. And it's important for me, Tamara, like to say that I believe I've taken a compassionate idea. Obviously, I have a very strong opinion of vaccines, and I'm obviously very pro-vaccine, like almost every doctor or healthcare worker I know. But I wanted to understand and make them three-dimensional. You know, they're not the villains in this story per se. But you know, as much as I think the belief is to a degree misguided, I wanted to. There's lots of intelligent, empathetic, you know, and you know, very involved people in the community who hold vaccine hesitancy and anti-vax beliefs, and I wanted to make them real people and put real rationale and motives for why they believe what they do, but also talk about the costs of potentially that belief. So,
and I think that, you know, people who I believe in vaccines, I believe in science. I just got my shingles vaccine, so now I can't get my COVID vaccine like I thought I could because I have to wait 2 weeks. My timing is so bad right now. So I'm counting down the days, you know. I can't believe it. Anyways, bad timing on my part.
The other way around.
I know, but I didn't know. I can't believe it. I took a chance to, you know, cross the shingles vaccine off my list, and my timing was bad.
Yeah.
But, you know, the anti-vax movement, if you will, or vaccine hesitancy, I mean, we all know where this really started from, right? It started from this idea from, you know, a guy named Andrew Wakefield who wrote that paper about autism, and it was the MMR vaccine, right?
Yeah.
And then a couple of celebrities got on with that, and then it just spread like wildfire, and now there's just so much misinformation out there.
Great, yeah.
What do you say to people who, I mean, and listen, I understand about being nervous, right? I get that. I'm a parent. Anybody who's a parent and thinking about vaccinating their kids, of course they're nervous, like we all are. But what do you say to people that are just so committed to not believing the science around vaccines?
It's difficult, you know, and because it becomes a religion. I mean, you're absolutely right. It was that very fraudulent Wakefield paper that cost him that, you know, he lost his medical license over, and you know, and there were criminal charges over because it was fraud. I mean, there was nothing to that study. But that's not the original. Anti-vax and vaccine hesitancy dates back as far as the smallpox vaccine. It dates back 200 years. It just took off. And, you know, it just so happened that study aligned to when social media and internet really took off. So misinformation, as you said, and these sort of echo chambers of your own belief systems really started to spring up. So it was the perfect storm. But you're right, that study has caused so much damage. It's caused a resurgence of measles in North America that didn't exist for years, you know. And I say to them that look at the science. I mean, there's been multiple studies that have proven there's a zero association between autism and the MMR. And of course, anybody who has an autistic child, it's a tragedy and you know a challenge for them to deal with, and you know a blessing for some people, of course, too. But in terms of you understand that need to just pinpoint something, to blame something, but vaccines. You know, any medication can have a side effect. Any medication is theoretically a poison, but vaccines are among the safest medications in the world. They're tested on, you know, even if we talk about this AstraZeneca side effect, this clotting, you know, you're talking 1 in 250,000 people. If Tylenol caused clots in 1 in 250,000 people, it probably wouldn't be pulled off the shelf. It is, you know, when you do see side effects from vaccines, they're so incredibly rare. It's amazing how safe most vaccines are. And so I try to make that argument, and I tell people I vaccinate my own kids, and I understand. I've been there. I understand the worry, but the dangers of polio and measles and all the things you're protecting are so much worse than could what, you know, some possible allergic reaction or other mild side effect that the vaccine could cause. And so, you know, but it's very difficult to get through to some people because it's not on a rational sort of scientific, you know, argumentative level. It becomes faith and religion for some people, the most ardent of the anti-vaxxers anyway.
It's interesting, you know, when I remember asking a friend who is a physician about the HPV vaccine. when my daughters were still quite small and nowhere near getting the vaccine.
Yep.
And I said, I'd read an article in a People magazine about a girl that did have the vaccine and something bad happened. And of course, it terrified me. And then it made me question what I already knew to be true and a fact. But because it scared me, all of my logic went out.
Yeah, it
Right?
became emotional. I totally get that, Tamara. But that anecdotal evidence that they use so often is the worst kind of evidence in the world. If I had a vaccine today and got hit by a bus tomorrow, it's not because I got vaccinated. But unfortunately, people do that all the time. There's such established easy ways in science to prove whether a side effect or a complication is associated with something. You just study two groups and you look at 1 million people and see, is the rate higher in one? You don't look at one person who had a bad side effect. It doesn't mean anything.
But that's what makes the news, right? Totally. It's like when a plane crashes, that's what makes the news. We don't report every time a plane lands safely.
Yeah, exactly. One of my favorite scenes is in the movie The World According to Garp, where the old John Irving book, and Robin Williams plays him, and they're looking at a property in the middle of nowhere and a new house, and out of nowhere this crop duster comes and crashes into the top floor, and Robin Williams turns to the realtor and says, "I'll buy it." And she says, "You'll buy it?" And he looks at her and goes, "What are the chances of that happening again?" Right? And it's the same kind of rationale. It's random, right? And you can't apply that kind of anecdotal evidence to anything. It doesn't mean anything, but it's so hard but you understand every time a plane crashes, you get nervous about getting on the next flight, even though your risk is no higher than it was the day before. And you're right, and people get terrified, but it's so important. But unlike other issues, like if you choose to smoke or choose to use drugs, that's a personal choice but the problem with vaccine hesitancy is that your choice affects other people. And if you can't reach herd immunity, if because there's a strong enough anti-vax movement that prevents enough people from getting vaccinated to protect the vulnerable in our community, you're exposing everybody to risk. You're not just making the decision for yourself, as people argue, for my kids. You're actually doing it. The point of vaccine is to protect society as a whole. It's not actually intended to protect individuals. I mean, that's a wonderful, beneficial secondary effect, but we need everybody to buy in. So, I now truly am on my soapbox, but these are some of the messages I tried to get. And I tried to do that in a human way. For instance, the hero's sister, the hero grew up in an anti-vax family on a farm somewhere. So she and her favorite niece, she has to fight with her sister to protect her favorite, niece with the vaccine. And then when this vaccine side effect that is in fact from tampering, somebody has deliberately tampered the product, she's so torn about the risk that she's exposing her niece to getting her vaccinated versus not. But it's the kind of same thing that you're using, the exact same analogy of just hearing about something bad and then, absorbing it yourself.
And so when we talk about your books, and so, Lost Immunity is the new book that's out right now. One of your other books, you crank them out, Daniel. You crank these books out. I don't know. I have dreamed of writing a book my entire life, and you've written 12. So there you go. I'm hoping that some of your energy and magic will rub off on me during this interview.
They get a bit easier.
So The Last High is another book of yours. You wrote it in 2020, and it is about the opioid crisis.
Yeah.
So this is something that obviously working anywhere in British Columbia in the medical field, you would be experiencing this crisis. And in the ER at St. Paul's, I'm sure it's something that's seen every day.
It's a kind of a tragedy. We've been living for 7 years. We are in the epicenter of there's an opioid epidemic, arguably an opioid pandemic and St. Paul's is in the we've lost so many patients. I've been at St. Paul's for 22 years. So patients that I knew on a first name basis are gone, and it's been devastating to see. And it's just such a waste. And I tried that book was a very personal book for me because it was meant as a warning for, kids that in their early 20s. It's not just the poor people living in the downtown east side with IV drug addiction issues. It can happen to anybody, opioid overdose and fentanyl in particular touches everyone, and almost all of us know somebody who's lost somebody to fentanyl. And and nowadays with the COVID pandemic, it's the perfect storm. We had the worst opioid overdose year ever last year, with over 1,700 people, most of them under 40, most of them young, dying from opioids, and alone and scared. And so it's a crisis that's not going away. And I think after we finally get over COVID, we're still going to be stuck with this terrible epidemic of opioids.
It kind of, when you think about what we just talked about, vaccines and the hesitancy there, when it comes to the opioid crisis, it's a totally different situation, because for me, I feel like there is a lack of empathy towards people who use drugs, for people who have mental health challenges and are self-medicating. People don't understand that by supplying safe drugs, you are saving lives. Nobody should die because they have, an addiction to drugs. But there is just this. I mean, I feel like this could have been fixed years ago if enough of us would have cared. Is that the problem? And I don't mean doctors. I mean the general community and government.
I don't. It certainly could be better than it was. I don't know about fixed. It's such a complex issue. But you're so right. There's so many crazy assumptions about opioids, and to treat it as a criminal problem has been such a massive mistake, when it always should have been viewed as a health problem. And and we could have done way more. We could have saved many lives, but we still can save many lives. To get people help and to get them a safe supply, right? I mean, alcoholics and cocaine addicts and gambling addicts, they ruin their lives. They go through hell, but most of them don't risk dying every time they take a drink or they go gambling. But every time an opioid user uses the tainted, terrible product that's on the street, they take a risk on dying themselves. And that's what we have to understand. We have to keep them safe till we can get them into treatment, till we can get them off drugs, because the years of life lost are incalculable.
Mm-hmm. And it's not just the downtown east side. It's not just, people who are addicted to drugs that are dying. You know what I mean? Like, it's not just. This is widespread. But because there's so much shame around addiction, it's rare for people to come forward and share their family's traumatic story, right? We do have some people that are brave enough and kind enough to come forward and share their story in the hopes of helping us all understand. Because I think that there's, and maybe I'm wrong, you would know this better from your experience in the ER, but it almost feels like when we see the pictures of people, in the downtown east side, after we hear about, it's like we tune out, like, oh, well, yeah, okay, well, they don't matter.
No, for sure. Some people that you would think would know better, who you think would be more empathetic than that, for sure. But it is desensitizing, right? And especially the way they present it. It's like seeing the orphans in Africa. After a while, you feel it's so far removed. It's not your world. But you're right. They are human beings with parents and grandparents and siblings and kids and stuff, and they're so much more deserving than that. But on top of which, don't be fooled. Don't think it can't happen to your son, your brother, yourself. It's incredibly how quickly people slide down that particular rabbit hole. And so, if you haven't been touched yet, you will be touched by the fentanyl crisis, and people have to be aware of that. And you're right. And it starts, first of all, with caring and some compassion, and then some effort to fix it.
Mm-hmm. So your books, there's two perfect examples, right? One book written about, vaccines, really, and, lost immunity. And then we have The Last High about the opioid crisis and fentanyl. Would you describe your books as almost like because they're fiction, it's almost like, I don't want to say it's not real life. It's based, you know what I mean? I'm trying to say, like, is it a learning opportunity for people without reading nonfiction? They get
totally.
like some characters and some ideas.
Yeah, I'd say two things. One, both of these in particular are kind of cautionary tales. Certainly The Last High. and lost immunity, about the risks of doing something wrong and not following, science, and being affected by prejudice. So first of all, it's that. But second of all, I love being able to share, a bit of knowledge, a bit of insider information, and educate a bit by telling a story. That's how I learned. Like growing up, I learned all my history reading James Michener stories, where he'd give you a hero, he'd give you a cast to care about. But as suddenly you're learning about the history of Russia or South Africa along the way. And this is my same attempt to teach people about understanding about vaccines, the science behind it, the effect of the anti-vax community, but through a big story where you actually are engaged with the characters, and hopefully a story that has a slightly happier outcome than COVID itself. So
Mm.
so yeah, I love being able to educate through story if I can. That's to me the highest compliment when someone says, "Yeah, I really like this character, but I also learned a thing or two from your book."
Yeah, it's a great way to learn. Okay, I before we wrap up, and I have just a few more questions because now I'm really curious about some things. Um, I just want to take a break to explain that during this pandemic, we have been looking for ways to give back, and one of the ways is we ask our guests to pick a charity that is important to them or means something to them, and you have chosen the Greater Vancouver Food Bank. Love the food bank so much. And we will be giving them $500 on your behalf. So thank you for choosing them. But maybe could you just tell me a little bit about why you chose the food bank?
I really think that COVID has had such a devastating impact on so many people, and people who were barely above the poverty line before were pushed below it. And most of us middle class and who have good jobs and don't worry necessarily about the next meal they have, but that's the most basic need and instinct. And if you're a parent with kids and you're worried about feeding them, to me it's the most important service to supply any human being, to make sure they're fed. And I think the Greater Vancouver Food Bank does a great job of distributing food to the needy, and I can't think of a more worthy cause during a pandemic.
Well, thank you for choosing them. So your book is out in the world, and your 12th book is out in the world. What do you do next besides, doing interviews like this for your book?
Book 13, of course. So yeah, I mean, but funnily enough, with the publishing schedule is always, as I said, I finished the first draft of this book the day I heard about a new virus coming out of Wuhan. Like, it was just about as I was learning. And then obviously in subsequent rewrites, I was able to include COVID, as it's not the central part of the story, but it's referenced, and as they go along. But I had already, I've already written a manuscript that's set in the northernmost town in North America, the second northernmost town in the world, in the Alaska, that deals with suicide and murder and some very important issues around that, and antidepressants and risks. And so I'm always looking for that next story. This one's a bit of a departure for me, much more of a dark psychological thriller with some huge twists rather than a medical thriller, but it still has some underlying medical themes to it.
Mm. When you think about your 20 plus years in the ER, what sticks out for you the most when you think about your career?
It's been a great career, and I've been lucky. I work at St. Paul's and Mount St. Joseph's, and there are two hospitals. We have lots of great hospitals in Vancouver, but those two in particular feel very much like family, like home. I can't explain it. We have huge longevity in the staff there, and it feels always like coming home when I go to work. It's a funny thing to say, but just in terms of the comfort level, and particularly at times we get jaded working the emergency department. You see, like, you're dealing with the same things over and over, and you don't realize the impact you make. But when COVID hit, and I was just so proud of the team, the bravery, the selflessness, which my colleagues, all of them, from the porters to the nurses to the doctors, approached. I said it's like kind of like running into a burning building rather than away from it. And it really sort of renewed my pride and my love for the the work I do and the career I have and the hospitals I work at.
I think that maybe in this noise of the pandemic and, people worried about whether they can, go to the beach or go to a party or go to a restaurant or whatever it might be, right? We're not banging pots anymore at 7 p.m. We haven't been doing that for, I don't remember how long. And we're in a much worse place than we were. Today we're in a much worse place than we've ever been in this pandemic. What about, what do you say to all of the healthcare workers, whether they're doctors, nurses, therapists, admin, cleaners, working in the cafeteria, whoever it might be, everybody that, most of us seem to forget about, who are doing all this. And when I say that, I'm talking about, maybe the entitled ones. That's who I'm talking about when I say, sorry. Yeah. I do feel, I can't help but feel a little bit of anger, and I'm not even a healthcare worker,
Well, but I think you'd be surprised about how much gratitude we felt from the community. It was great when they were banging pots, but even still, the number of people who have thanked me and, the number of people who thank my colleagues, I think there has been appreciation in the community. And for me, it's just, it's just admiration for my colleagues that everybody's been so stoic and you rarely hear them complain very much. They just go and do incredible jobs. And yeah, we are at a darker point in terms of the ICUs are full, but we're also very much at the light at the end of the tunnel point. If we can just make it a few more months, we're starting to see the other countries that are ahead of us in vaccination schedule and the effect it's having. And so I think there's hope, and even amongst us, because as we were fortunate enough in the emergency to get vaccinated early, it's given us a sense of security and safety that we didn't have before. As it's always darkest before the dawn, right? And I think that's the point we're at right now, but we're getting closer.
Daniel, thank you so much for taking the time to talk to us. I really appreciate it. Lost Immunity is out right now. Wherever you buy your books, you can find it. And if you want to follow Daniel, you can follow him on Twitter at Daniel Kalla. And you can also check out his website, danielkalla.com. I really appreciate your time, Daniel. Thanks for listening to another episode of TELUS Talks with Tamara Taggart. Be sure to subscribe so you can join us every Tuesday for another conversation. You can also check out our website, telus.com/podcast, and subscribe to our YouTube channel at TELUS Talks.